Studying for the board exams? Don't lose easy points on family planning and contraception. Combined hormonal contraceptives use both estrogen and progestin to suppress ovulation. For exam day, you must memorize the warning signs for estrogen therapy using the acronym ACHES. A. Severe abdominal pain, indicating gallbladder or liver issues. C. Chest pain or shortness of breath, pointing to a pulmonary embolism or MI. H. Sudden, severe headaches, signaling a potential stroke. E. Eye or vision changes from vascular occlusion. And S. Severe leg pain or swelling, indicating a deep vein thrombosis. Estrogen is strictly forbidden in clients over 35 who smoke or anyone with a history of DVT, stroke, uncontrolled hypertension, or focal migraines. What about non-oral combined options? The transdermal patch is applied weekly for 3 weeks, followed by 1 patch-free week. Apply to clean skin on the torso, abdomen, or upper arm, never on the breasts. Also note, the patch is less effective in clients weighing over 198 pounds. For the vaginal ring, it stays in place for 3 weeks, then 1 week off. If the ring is expelled or removed for more than 3 hours, the client must reinsert it and use a backup barrier method for 7 days. Now, let's switch to progestin-only options like the Minipill. Timing is everything. If taken more than 3 hours late, the client must use a backup barrier method for the next 48 hours. The Minipill is also the preferred hormonal choice for breastfeeding parents because it doesn't affect milk production. For Depo-Provera injections, given every 11 to 13 weeks. Never massage the IM injection site post-shot, or you'll accelerate absorption and shorten its duration. Remind clients to take calcium and vitamin D due to bone mineral density loss with long-term use. Moving to LARC, long-acting reversible contraception. The non-hormonal copper IUD lasts up to 10 years and can serve as emergency contraception, though it increases menstrual bleeding. Hormonal IUDs like Mirena or Kyleena lighten bleeding and last 3 to 8 years. Teach clients to check for strings monthly after menses. If IUD complications arise, recall the acronym PAINS. P. Period late or abnormal spotting. A. Abdominal pain or painful intercourse. I. Infection exposure or abnormal discharge. N. Not feeling well, like fever or chills. And S. String length changes or missing strings. There's also Nexplanon, a flexible subdermal implant placed in the inner arm that releases progestin for up to 3 years. Emergency contraception, or EC, oral options like Plan B work best within 72 hours, while Ella works up to 120 hours post-coitus. Testing Pearl. EC delays ovulation. It does not cause an abortion or harm an established implanted pregnancy. If the client vomits within 2 hours of taking oral EC, they need to call their provider for a repeat dose. Barrier and natural method rules. Diaphragms must stay in place for at least 6 hours post-coitus, but no longer than 24 hours to prevent toxic shock syndrome. Remember, diaphragms require a clinical refitting after a 10-pound weight change or pregnancy. Watch for toxic shock syndrome signs on Select All That Apply questions. High fever, sudden hypotension, a sunburn-like macular rash, and watery diarrhea. For condoms, only latex or polyurethane protect against STIs. Lambskin condoms do not protect against STIs due to microscopic pores. For natural family planning math, subtract 18 from the client's shortest cycle length to find the start of the fertile window, and subtract 11 from their longest cycle length to find the end. There are also permanent sterilization options such as vasectomy and tubal ligation, which carry their own risks. And for infertility workups, a semen analysis is always the first, least invasive diagnostic step. Remember, every method has pros and cons, and contraceptive choice is always tailored to individual health history and client preference. That is your complete, high-yield family planning review for the boards. Save this lesson, share it with your study group, and drop a comment below letting me know which clinical topic we should cover next.